Today on this very special edition of Cancer Buzz, the state of oncology, as told by two ACCC presidents. Welcome back to Cancer Buzz. I'm your host, Summer Johnson. In March of this year, ACCC members from across the country met in Washington, D.C. and online for the association's 48th annual meeting and Cancer Center Business Summit. The annual meeting is an important forum every year where oncology professionals discuss the latest trends and advancements in the business, policy, and technology of cancer care. We caught up with Krista Nelson, ACCC president, as she wrapped up the final days of her very busy 2021 term. Krista, outline for us your president's theme, if you will, and some of the highlights and successes of the supporting ACCC programming.
Thank you so much. My ACCC theme was focused really as we are emerging, we thought we would be emerging out of COVID, and instead we're still sort of in COVID. But we've learned these real life lessons, and I think I focused on three main themes. One was support for the caregiver, and I'm going to say that first because I think having been doing the direct work and witnessing the suffering among the staff and the support, it's really just making sure we have supportive interventions and education to support. So we did a lot of things like mindfulness sessions for our members. We did a lot of coffee chats, which for me was this opportunity to connect, but also a way to support and hear what was going on with our membership. The second part of my theme was around diversity, equity, and inclusion. And I think what we've seen so much has become just so apparent in our country and in our cancer centers is trying to pay attention to how health equity can be improved, barriers to care, and what we can do to help support centers in becoming aware of their own bias. And thirdly, which is something also very close to my heart, is helping build a business case for supportive care, specifically how to hire oncology social workers. We know that comprehensive cancer care is the right thing to do. And we also know that if we pay attention to social determinants of health, that we impact cancer care and we will have better outcomes if we pay attention to those and have people to address those in our cancer center.
We're here at the annual meeting this week, and we've heard from a lot of folks this week that you were just the right president at this time during this challenging year. Can you talk about some of the conversations you've had with ACCC members over the past year on how this programming impacted them?
Yeah, I think as a social worker, I'm obviously very connected to story and to connection and community. And ACCC is this giant community. And I have had this opportunity to connect and hear firsthand from many people the struggles, staffing, vaccines, mandates. I mean, everything. I just think back to how much things have changed in the past couple of years. I think what's been most meaningful is really at every moment making sure that the leaders are taking care of themselves and having a pause, acknowledging the suffering, but also then moving forward and feeling supported by some of the programming that we have created. And what we've tried to do is have some tools, how can they support their members and have those easily accessible on our website.
You're passing the baton today to Dr. Penberthy, and you both have themes that focus on improving patient care. What are you hoping that you've left with ACCC members and the greater oncology community about the connection between patient care and staff resiliency?
There's a study, actually, that was done by one of my colleagues, Dr. Pearl, and it was around palliative care and end of life. And one of the findings that came out of that were that physicians who were more burned out, those patients were more depressed. Now, which caused which, we don't know. If you take care of a group of patients who are more depressed, it's probably harder to come to work. And if you have an oncologist who's burnt out and stressed, or a provider, a social worker who isn't really listening, how does that make us feel as individuals? So the equation that we can control at ACCC and that we can help provide education in is how we support our providers, the people that are out there. And I think that goes with leaders too, because everyone in the healthcare team and everyone who's a member of ACCC, they may not be providing direct care, but they are impacting the team. Burnout is a cycle. And so we have to make sure that our leaders are feeling resilient, our providers are feeling resilient, and therefore our patients will feel that compassion as well.
Finally, what have you heard from the panels and sessions at the annual meeting this week that has encouraged and excited you about the future of cancer care?
I can speak to the last panel we just had. Was around building supportive care programs and looking at benchmarking data. I think a lot of people want to improve care, but we just don't quite know how many of each staff we need and how they should be positioned. And the thing that I'm feeling most hopeful about is that all these business meetings and these business plans, we're hearing plan early. Think about putting supportive care into your performa at the beginning. I think as we look at staffing ratios and we looked at number of providers, and we're going to use this model for other disciplines as well. We started with social work, and we're saying, okay, we have one social worker per 300 patients and per 4.5 providers. That gives information to cancer centers when they're building performas, when they hire some new doctors to say, hey, we're going to need a 0.4 social worker and a 0.2 genetic counselor. So I'm really excited about us doing the research to give our membership the information they need to be able to provide the best quality care at their cancer centers.
Also at the meeting, Dr. David Penberthy was named ACCC's incoming president. Dr. Penberthy is the medical director of radiation oncology at Secours Southside Regional Medical Center in Petersburg, Virginia. We spoke with him right after that announcement about his plans for his 2022-2023 tenure.
So this is an exciting time in oncology. The science of oncology is completely expanding, exploding, and one of the challenges as a practicing oncologist is staying up to date with the latest, greatest treatment techniques. And so I think ACCC is uniquely positioned to actually promote best practices throughout the nation in both community oncology practices, academic oncology practices. And so I really want to use this next year to promote best practices. And I think with technology, we can also leverage that to actually improve patient outcomes, patient experience, and all of that.
So that leads us into your presidential theme, Dr. Penberthy. Why don't you outline that for us for the next year?
Well, we want to kind of surveil all the oncology programs and ask them what their pain points are and figure out ways to alleviate those pain points. And sometimes it's ways large and small, so if somebody has a solution for fixing a challenge in too long of a waiting room experience, we want to promote that. And so we want to leverage technology to improve the oncology workflow, patient experience, and ultimately improve their outcomes.
What are some of the projects that you've been involved with at ACCC leading up to this point?
So I've been affiliated with ACCC for several years now. I've served as the treasurer at ACCC. And the treasurer, you actually get to see a very granular way of how ACCC kind of interacts with all the state societies, all the different organizations. And it's really a collaborative organization, multidisciplinary. And you get to kind of coalesce all the different perspectives. It's not just medical oncology, radiation oncology, it's surgical oncology, but all the associated patient experience factors such as nutrition and social work and navigation and transportation and all that sort of thing. And so ACCC is a great organization for figuring out how to optimize the patient experience in so many different ways.
Dr. Penberthy, what has been the most eye-opening or exciting thing for you over the past several days here in Washington, D.C., meeting with your colleagues?
Number one is this is my first meeting since the pandemic where we're actually getting to meet in person. So I think I have a little bit of Zoom fatigue that I think many of us may have. And so I really like the information that's being promoted, but also the side conversations that you have, over lunch, over dinner. And it's just, I think, a more rich experience. And so I'm really looking forward to having more in-person meetings.
We'll be following along as for your tenure over the next year. Thanks, Dr. Penberthy.
Thank you for having me.
For more on this year's annual meeting, and to learn more about both of these presidents, their priorities, and the related ACCC programming, You can check out the links in the show notes. We know your time is valuable, and we want to thank you for supporting Cancer Buzz. For the entire Cancer Buzz team, I'm Summer Johnson.
Cancer Buzz is a resource of the Association of Community Cancer Centers.